Hello, everyone. My name is Rick Page. I'm so pleased to welcome you all on this very special, although a bit rainy afternoon here in beautiful Vermont, to a really special day. This is an event that is among our university's most revered events, and that is the investiture of a new endowed professor or chair. And today is unique in that we have the pleasure of recognizing and celebrating not just one, but two of our outstanding faculty members from the Department of Surgery who will receive green and gold professorships, Dr. Michelle Sowden and Dr. Donald Laub. These investitures are part of a larger celebration as well. In fact, in 2013, the Department of Surgery established green and gold professorships in each of their divisions, and today we're celebrating the filling of all of these professorships and these very special appointments. I should mention also, in addition to a standing room only crowd, thank you so much for being here, we have others joining us on live stream to celebrate this special day in the lives of two of our most distinguished faculty. These investitures are especially important in that we are able to invite guests, and we have special guests with us here today. First of all, President Patty Prelock is in the house, as well as UVM Foundation President and CEO Monica DeLisa. I also want to welcome Dr. Mitchell Narotsky, who holds the Stanley Fieber Chair, and he's chair of the Department of Surgery. We're honored also, very honored today, to welcome Linda Leitner, who along with her late husband, David, helped to fund one of these green and gold professorships that we're celebrating today, and you'll hear more about that in a moment. In addition, we have several other guests. I know Noma Anderson, Dean of the College of Nursing and Health Sciences, who's just a wonderful partner to me, who attends these as often as she is able, and I believe Senior Associate Dean for Clinical Affairs and President of the Medical Group, Jason Sanders, will be here representing the UVM Health Network. We're so grateful when people endow these professorships in that they directly support our faculty, allowing our faculty to advance research, instructional programs, and clinical service in their respective fields. Endowed positions such as these two we celebrate today are enormously important and among the highest academic honors the University of Vermont can bestow upon its faculty. Investing in outstanding faculty members with endowed chairs and professorships allows the university and our college to recognize and celebrate academic achievement of our faculty and to further encourage scholarship, service, and clinical excellence. At the Larner College of Medicine, named professorships are important in marking the successful trajectory of our high-achieving faculty members. And by providing dedicated resources for research and scholarly opportunities, these positions enable our faculty to excel at the highest level. They also help us recognize our most distinguished researchers, scientists, clinicians, physicians, and leaders. Dr. Sowden and Dr. Laub join this prestigious group of the endowed professorship and chair holders at UVM. Recruitment and retention of faculty is among the most important things we do as a university. And by retaining faculty such as Dr. Sowden and Dr. Laub, we create a dynamic and engaging environment that provides exceptional education and mentorship to our medical students, our graduate students, and really everybody in our community. For all these reasons, on behalf of the Larner College of Medicine, I'm tremendously grateful for the gifts from the Department of Surgery and from David and Linda Leitner. It's now my pleasure to introduce President Patty Prelock to speak on the importance of these special designations as endowed professorships. Specifically, we will start off with Dr. Sowden. This is a new one for us, having two at a time, but makes it extra special, as you'll see at the end. First off, we're going to address all our attention to Dr. Sowden, so please join me in welcoming President Patty Prelock.
Thank you so much, Dean Page, and thank you to everyone who's in attendance today and showing your support for two outstanding faculty members and to celebrate the incredible generosity and vision of the Department of Surgery. Once again, I love saying that, Mitch, and as well as the generosity of David and Linda Leitner, so thank you so much. It's a great honor, as Dean Page said, to participate in this academic tradition, which is so important to our university. And our first recipient, Michelle Sowden, is being recognized for her exceptional record of service that she brings to medicine, to our university, and to the medical community. It is quite fitting that Dr. Sowden is receiving this honor during Breast Cancer Awareness Month. Dr. Sowden received her Doctor of Osteopathic Medicine from Midwestern University in Glendale, Arizona in 2002, and then she completed her internship and residency at Mount Clemens Regional Medical Center, a Michigan State University affiliate, before completing an interdisciplinary breast fellowship at Yale University. She joined the Larner College of Medicine in 2011 as an assistant professor of surgical oncology and was named an associate professor in 2016. Michelle specializes in the surgical treatment of breast cancer and benign breast issues. Her main role is that of clinical patient care, but she also holds several leadership positions at the UVM Medical Center and continues to be very involved in resident and student medical education. The Larner College of Medicine is extremely fortunate to have Dr. Sowden on faculty, as she is the only surgeon in the state of Vermont that has a dedicated breast fellowship. It is through her devotion to breast cancer research and care that Michelle and all of the faculty and staff affiliated with the Department of Surgery demonstrate what it means to be part of an academic medical center and our outstanding Larner College of Medicine. I am grateful for the department's and the college's vision and acknowledgement of academic excellence, of which Michelle is a great example. And she's not alone, nor is the Department of Surgery. We have innovative research that is happening all across campus as we're trying to build healthy societies and healthy environments, and it engages faculty, staff, and students, really helping us to fulfill our land-grant mission. So as I've said, each time that I have done one of these, I will continue to prioritize increased support and resources for leaders like Dr. Sowden and for the Larner College of Medicine, the Department of Surgery, and for every facet of research here at the University of Vermont. So Michelle, I am thrilled to welcome you to this esteemed group of endowed professors and chairs. We look forward to celebrating your continued exceptional achievements, and congratulations.
Thank you so much, President Prelock, and really I want to acknowledge the fact that Patty Prelock, as provost, always attended these with a smile and really has enjoyed being a part of just about every investiture that I've been a part of in the last 6 years, and it's really an honor that you now as president have continued this tradition in supporting our college and the outstanding faculty that we recognize at these events. The other thing I need to mention is I don't think we've had as big a crowd for an investiture in a long time. It's wonderful to see everybody here, and also to see some people, either medical students are getting younger and younger, or we have family and friends that are here in the audience, and it's really a pleasure to celebrate this event with all of you. I now get to bring up forward Mitchell Narotsky, chair of the Department of Surgery. Dr. Narotsky has been on the faculty 27 years, 14 of which he has served as chair of the department, and he'll be able to provide some further insight on Dr. Sowden, and we'll be introducing her to us. Please join me in welcoming Chairman of the Department of Surgery, Mitch Narotsky.
It's great to see everybody out here. Thank you, Dean Page, and thank you to each and every one of you for coming today as we celebrate the investiture of Dr. Michelle Sowden as the inaugural holder of the Department of Surgery's Green and Gold Professorship in Surgical Oncology It is truly my honor to introduce Michelle to those of you that know her and don't know her. As you've heard, Dr. Sowden joined the faculty in 2011 as a member of the Division of Surgical Oncology. Since that time, Dr. Sowden has developed into a highly respected member of the Department of Surgery. As you've heard, she maintains a busy clinical practice focusing on breast cancer and benign diseases of the breast. She has served as the leader of UVM's Transdisciplinary Breast Cancer Center since 2017. This is a role where she leads the group in evaluating clinical protocols and research opportunities that exist here for the UVM Medical Center and throughout our network. Dr. Sowden has also served as the Director of Surgical Oncology since 2012. This is a leadership role that entails a lot of work behind the scenes. She basically is in charge of the day-to-day operations and oversight of everything that goes on in the surgical oncology clinic and on their service. Earlier this year, Michelle was elected to the UVM Health Network Peer Review Committee, which shows how much respect her colleagues have for her. Dr. Sowden provides her patients with outstanding clinical care. She is cognizant of her patients' medical as well as their psychosocial needs. As those of us who know her, she is always there for her patients. Michelle interacts beautifully with all members of the breast care team. She's confident in her own surgical knowledge, but is also open to listening to other providers' thoughts, assessments, and treatment plans. Her caring, soft-spoken demeanor is appreciated by everyone that she interacts with. As a side note, this demeanor is actually helping the Department of Surgery to break the stereotype of what a surgeon truly is. And Michelle, for that, we thank you. You are giving all surgeons a good name. Due to her clinical expertise and wonderful bedside manner, it is not surprising to learn, as I did from the UVM Foundation, that Michelle has received over 30 gifts in her honor from patients and families that she's cared for. There is no higher compliment than when patients and families acknowledge your work. In addition to her work as a clinician and a leader, Dr. Sowden has excelled as a teacher of surgical residents and medical students. Her evaluations are consistently excellent. She previously served as our Associate Program Director for General Surgery Residency and is currently a member of the department's Curriculum Competency Committee, which is essential as each resident in surgery gets evaluated on an annual basis to see if their performance merits promotion to the next clinical year. It is clear to all of us that Dr. Sowden is an outstanding clinician, educator, and leader. However, it is my opinion that one of Michelle's greatest contributions to the Department of Surgery is her ability to serve as a role model for women pursuing a career in surgery. Medical students, surgical residents, and junior faculty all seek out Dr. Sowden to gain advice as how to balance the demands of a busy surgical practice and one's personal life. I truly believe that the large number of medical students and surgical residents that have spoken with Michelle have chosen to pursue careers in surgery, and that is truly due to her interactions with them. Michelle, for me, it has been an absolute pleasure to watch you mature into a highly respected faculty member. Thank you for the advice when I call that you give me. You are always polite and professional, but you do not sugarcoat it, and I appreciate that. So I leave our conversations knowing exactly how you feel, and that is very helpful. I am so pleased to recognize you as the inaugural holder of the Green and Gold Professorship in Surgical Oncology. Congratulations. Thank you. We will now present Dr. Sowden with a medallion that marks this occasion and signifies her status as the holder of an endowed chair. We hope that she will wear this with her academic regalia at commencement and other official university functions.
I'm just going to wear it all the time.
Make sure you sterilize it in the OR. Dr. Michelle Sowden is a highly respected researcher, clinician, teacher, and scholar. She has dedicated her career to improving the lives of patients and families who face complex and challenging journeys. Through research, teaching, and leadership, she will ensure that we constantly improve our ability to care for patients here in Vermont and around the world. Her presence brings great distinction to the Robert Larner College of Medicine at the University of Vermont and to the Department of Surgery. Dr. Sowden, the inaugural Green and Gold Professor of Surgical Oncology in the Division of Surgical Oncology, we honor you today with this medallion, which serves as an enduring symbol of the excellence you strive to achieve in all aspects of your professional life. Congratulations.
Thank you. Somehow I was expecting a tiara, but this is really cool too. So I have found research to be sort of one of the more surprising aspects of a surgical career that have been very satisfying for me. And this sort of endowment really helps us to continue that research and move things forward and do that with our residents and medical students. So I really appreciate this endowment. If you get to this point in your life, you usually have a lot of people that have supported you along the way. And so I wanted to take a few minutes to thank some of those people. So I was born in 1973. I will be turning 51 next week. I expect cards from everyone. And so when I was born in 1973, women represented 7% of faculty in medical schools and actually attending physicians. And if you look for the numbers of general surgery females, there are none. You can't find them. They just didn't exist. So it makes the story of my birth kind of crazy. So when I was born, number one surprise, I was a girl. My parents were not expecting that. Number two, my mom, as she was checking me out, apparently I had freakishly long fingers. And she said to my dad at the time, "Look at her beautiful hands. She could be a surgeon." To which my dad appropriately should have said, "Are you crazy? Girls aren't surgeons." And he in fact said, "She could be anything she wants. She could totally be a surgeon." I think that to have that kind of support right out of the gate is something that you just can't even put a number on for how important that is. And so to my mom, Vicki, who's here, and my dad, Gary, who's up in heaven, I really appreciate it. When I was little, the biggest idol in my life, and probably still one of my biggest idols, was my brother Gary, who is here today as well. And he has given me all of the anxieties I have about perms. If you'd like to ask him about my 5th grade perm, it was really stellar. This is natural curl, so don't add perm. And so when I went to get married to my husband, instead of having a maid of honor, I had a man of honor because that's how important he was to me, so thank you. So that was my sort of given family, and then there's the family that you choose, and the first person that I chose was Ethan. Ethan and I got married right before I headed off to medical school, and so he's been with me on this entire crazy journey. He was with me when my dad had his accident in my 3rd year of medical school, and I just picked up the pieces for the entire year. And when it came to the end of the 3rd year, I was still in a bit of a state of shock, and everyone appropriately was like, "So what are you going to do with your life? We need to start making, applications." And Ethan said, "Well, aren't you going to do surgery?" And I said, "Well, the lifestyle, it's horrible." And he said something very smart, and I tell all the medical students and residents this. He said, "Everyone in medicine works really hard. You should do exactly what you love, and we will figure it out." And we have for a really long time. So as part of the whole story of being shocked by my dad's death, I was in this place of thinking, wow, life is really short. And so I decided I was going to get pregnant, like at midway through my 4th year of medical school, which is a really weird time to do it. And so I went to all of my residency interviews hiding a tiny little parasite in my stomach that was Aiden. And so when I matched at Mount Clemens, which was my top choice, I felt obligated to reach out to Dr. Johnson and say, wow, I'm super excited to come to the residency, but I am so pregnant. And he said, Dr. Johnson, who's right back there, said, well, let me be the first to congratulate you, and we'll figure it out. So, and we did, and what an amazing mentor. He's always been there for me. So Aiden was the reason that I have such good work-life balance, because when you're a resident and you have a tiny infant at home, you have to remember that you are both a human and a surgeon. And so Aiden was at home being his vivacious, wild, hilarious, talkative, amazing self, and he was the reason, one of the big reasons that I was trying to get home to be with him. And so for that, Aiden, I'm really appreciative. Then along comes Foster, and the first thing I learned from Foster was how to operate sideways. He was a massive baby, and I couldn't reach the table if I operated like at the table because he was so big. And when he came out, the things that he taught me were how to slow down, how to have more presence, how to be more mindful. And I am so grateful to both of you for being there over the years for me. I swear this won't go on too much longer. So I would be remiss if I didn't say a thank you to my incredible friends who feel like family, and my family that feels like friends. So to Tessa and Remy and Grant and Schaefer, thank you for coming, and Tom and Mariah and Kim and Candace. You all are the people who bolster me and keep this whole thing going. When you decide to go into surgery, everyone asks you why you want to be a surgeon. And for me, it was a lot about the community that you have in a surgical suite. When you're in the operating room, everyone is collectively working towards keeping a very vulnerable person who cannot take care of themselves. You are there for them during that time. And so for me, that community is so inspiring, and the people that I work with here are truly world-class. So thank you to the surgery team. The flip side of this is that you have to spend a lot of your time in the clinic as well, and the breast care clinic here is absolutely extraordinary. Our staff fights for our patients every day. They are so caring and thoughtful and kind. You all make me look so good. It's just really incredible. And in surgical oncology, we are not a one-woman team. We have a whole group of people that are there to take care of our patients. And a lot of you are here today, and I really appreciate the collaborations that I have with you. Just bring me such joy. I am so happy to work with you. 2 more. Okay. So, to those folks standing in the back in the scrubs because they're about to go and run and take care of a patient. The residents are one of the scariest things that I deal with. It is kind of scary. And also one of the things that brings me such incredible pride and joy, watching you grow into the surgeons that you become. I have no words for it. You inspire me all the time, and I'm so grateful for both the residents and the medical students. Last but most importantly, not least, the people that I work with range in age from 25 years of age to 95. They're both men and women, and I get to be with them during the worst, most horrible parts of their life, right? They just got a cancer diagnosis. It's really profound. And I am so deeply appreciative of the fact that you let me be a part of your cancer journey. And so I dedicate this to my patients.
Wow, thank you for those amazing words. Thank you for acknowledging the patient's family and staff. We can't do anything around here without our staff, and I know we have staff here today, and for all our missions, we're tremendously grateful. Thank you again, and again, congratulations. I now get to invite Dr. Narotsky back up. We're going back and forth a few times here. And what is special about an investiture is we get to acknowledge the people who have made it possible. And for that, I get to acknowledge Dr. Narotsky as he represents the Department of Surgery. So the formal words are Dr. Narotsky, the generosity of the University of Vermont, Department of Surgery has made this and several other endowed green and gold professorships possible. And it will stand as an enduring legacy of your department's unceasing efforts to improve the lives of patients and their families throughout the region and beyond, in keeping with the missions of the university and the Larner College of Medicine. On behalf of your department, I ask you to accept this duplicate of the medallion that we've just presented to Dr. Sowden. We hope this will serve as a tangible reminder of how grateful we are for the extraordinary support that you have provided for our faculty in terms of these endowed professorships. Thank you so much. So now we get to shift gears and proceed with the second investiture of this really special afternoon, as we get to acknowledge Donald Laub receiving the Linda A. and David W. Leitner Green and Gold Professorship in Plastic Surgery. But before we get to that, I'd like to tell you about this endowment's namesake, Dr. David Leitner. Dr. Leitner joined the Larner College of Medicine faculty in 1984 and retired 31 years later in 2015. He served twice as chief of the Division of Plastic and Reconstructive Surgery from 93 to 2007, and then from 2012 to 2015. He was also a leader in clinical care for the entire state of Vermont. In 1985, he founded the UVM Medical Center Microvascular Reconstructive Surgery and Reimplantation Service, and he played a key role in the Vermont Department of Health's Children with Special Needs program by staffing the Cleft Palate and Congenital Hands Clinic. Sadly, we lost Dr. Leitner earlier this year in February. With us today is his wife, Linda, partner for over 48 years, for whom the endowed fund was named as well. Thank you, Ms. Leitner, Linda, for your and Dr. Leitner's vision and for being with us today. We're truly honored. Now I'd like to invite President Prelock back to the lectern to share some words about this investiture. Please join me in welcoming back President Prelock.
Thank you so much, Dean Page. As I previously said, it's such an honor to be here with you to support two outstanding faculty members. Michelle, thank you so much for your words. They were inspiring. As the female leader, I was like, double down on your activity. Amazing. And also to the Department of Surgery again, and to Linda, thank you, and to your late husband, David, as well. As Dean Page stated, the second recipient to be honored is Donald Laub, and Dr. Laub is being recognized for his exceptional service to medicine, specifically in cleft palate surgery, that he brings to the university and to our medical community. As a speech-language pathologist, I so appreciate the work that you do to support children with craniofacial differences that really impact their ability to swallow, to speak, and to have their own voice. So thank you for that. Dr. Laub received his medical degree from the Medical College of Wisconsin in 1990, and he went on to complete residencies at Oregon Health Sciences University Hospitals in Portland, Oregon, and the Dartmouth-Hitchcock Medical Center in New Hampshire. He completed 2 fellowships, one at Dartmouth-Hitchcock Medical Center and one at Stanford University Medical Center, before joining us as an assistant professor in 1997. Today, Don is a professor of surgery in the Division of Plastic and Reconstructive Surgery. Dr. Laub specializes in skin cancer surgery, hand surgery, the cleft lip and palate multidisciplinary team care and surgery, and gender affirmation surgery of the chest. He has had a stellar career exemplified by service to others, including serving as a reservist in the United States Army Medical Corps for 15 years. Thank you for your service. As Vermont's only pediatric plastic surgeon, one of Dr. Laub's most important works includes the transition and reorganization of the cleft palate craniofacial multidisciplinary clinic from the Vermont Department of Health to the UVM Health Network. It is through his devotion to plastic and reconstructive surgery and care, especially to our children here in Vermont, that Dr. Laub and all the faculty and staff affiliated with the Department of Surgery make a difference for our children, their families, and all who require their services. So a big thank you to Dean Page, Chair Norotsky, to Linda and David Leitner, and all members of the Department of Surgery. Your commitment to academic excellence in patient care is tremendous, and I think the obvious thing is with Michelle and Dawn, they are truly wonderful heroes in the care of patients, so thank you for what you do.
Thank you so much, President Prelock. It's now my pleasure to invite back Dr. Mitch Norotsky, who's going to introduce Dr. Laub for us. Welcome, Mitch.
Thank you for letting me have part two. So this is so appropriate. When Michelle and I were talking before this, we said how appropriate that she and Don are getting it on the same day, as these two divisions work so closely together. So it is most appropriate. This investiture for Dr. Laub has special significance for both myself and Dr. Laub, as well as many of you here in the audience who had the distinct pleasure and were fortunate enough to have worked with David Leitner during his 31-year career here at UVM. David and Linda have been and continue to be dear friends of the UVM Department of Surgery. Thank you, Linda. I can tell you that Dr. Leitner impacted my own professional development in a number of ways. Those of you who've worked with him, he was a superb technical surgeon who taught me how to handle tissues, how to suture in a non-traumatic fashion, and how to develop tissue planes. He taught me how to care for patients and demonstrate compassion, especially for the most fragile patients. The patients that I always remember with him, and I'm sure the residents still do to this day, are the unfortunate people with neurologic compromises that have decubitus ulcers and sort of fall in between the cracks. But David was always there to accept those patients and care for them, not just for their plastic surgery needs. I truly appreciated the way Dr. Leitner treated everybody. He showed me great respect at all times, not just when I was the chair of the Department of Surgery or when I was a colleague of his or a surgical resident, but always the same as a medical student. This is something that I've tried to emulate from Dr. Leitner each day, is to treat everyone that you interact with the same level of respect, regardless of where they stand in the organizational chart. And that is something that I try to live by, and I encourage all of our residents and students to try the same, just as Dr. Leitner did. Dr. Leitner also taught us how to speak up when you think you're right. That is not easy for many of us, including myself, but I can still remember as a junior faculty member attending surgical department dinners, and Dr. Leitner would speak up to the present leadership there when he was passionate about an issue. And many of us in the back of the room were saying, "You go, David, thank you so much." Today, we are here to recognize Dr. Donald Laub, who's the ideal choice as the inaugural green and gold professor in plastic surgery. I say that he's ideal because Don and Dr. Leitner worked together for 18 years. They both are highly respected clinicians who cared greatly about their patients. As you've heard, both of them have served as the surgical director for the Vermont Department of Health's Children's Cleft Palate and Craniofacial Clinic. Dr. Laub is passionate about serving others. One of the things that I've admired since Don, and later in his career, he's expanded plastic surgery throughout the Vermont and through the UVM Health Network. He now goes down to Porter Medical Center in Middlebury to expand plastic surgery services there, both in the clinic and in the operating room. The amount of positive feedback that I receive about that cannot be fully expressed, so thank you, Don. Don was also a counselor to the New England Surgical Society of Plastic and Reconstructive Surgery for 4 years. You heard about his service in the Army Reserves. In my opinion, Dr. Laub's greatest service has been providing surgical care for the medically indigent population, both here locally in Vermont, where he's a surgical volunteer at the Community Health Center, and as many of you know, his global trips throughout the world to places such as Guatemala, Honduras, and Vietnam. It comes as no surprise to any of us that Dr. Laub was honored with the Department of Surgery's John H. Davis Award for Service. Dr. Laub has also excelled academically. He's the editor of a book entitled Congenital Anomalies of the Upper Extremity, which I have a copy of on my desk. He's authored 16 medical chapters and numerous peer-reviewed publications. As an educator, Dr. Laub is very unique in that he has held 3 academic appointments in 3 different departments: the Department of Surgery, the Department of Pediatrics, and the Department of Orthopedics. As a result of this, he has been teaching surgical residents, pediatric residents, and orthopedic residents for many, many years, and also takes great pride with his interactions with medical students from the Larner College of Medicine. Don, I can tell you I speak for the entire UVM community when I say thank you for all that you have done to improve the lives of others. It is truly a privilege to recognize you as the inaugural holder of the Linda and David Leitner Green and Gold Professorship in Plastic Surgery. Congratulations. It is now our chance to present Dr. Laub with a medallion that marks this occasion and signifies his status as the holder of an endowed chair. We hope that he will wear it with his academic regalia at commencement and other official university functions. This is the part where I swear you in now. Dr. Donald Laub is a highly respected researcher, clinician, teacher, and scholar. He has dedicated his career to improving the lives of patients and families who face complex and challenging journeys. Through research, teaching, and leadership, he will ensure that we constantly improve our ability to care for patients here in Vermont and around the world. His presence brings great distinction to the Robert Larner College of Medicine at the University of Vermont and to the Department of Surgery. Dr. Laub, the inaugural Linda A. and David W. Leitner Green and Gold Professor of Plastic Surgery in the Division of Plastic and Reconstructive Surgery, we honor you today with this medallion, which serves as an enduring symbol of the excellence you strive to achieve in all aspects of your professional life. Congratulations. Congratulations, well deserved.
Well, thank you. Thank you, President Prelock, Dr. Narotsky, Dean Page, Linda Leitner, colleagues, friends, everyone. I'm honored to be invested as the inaugural Linda and David Leitner Green and Gold Professor in Plastic Surgery on the day before David's birthday. It's a great honor not only for the academic reasons described so well by Dr. Narotsky, but also because it honors the memory of my friend and mentor, David Leitner. I will strive to live up to his example of enthusiasm, hard work, zeal for teaching, and love of life that David demonstrated through his life. They say that it takes a village to raise a child, but it takes a team to make a surgeon. And I see, looking around here, all the members of the team that I'm so happy to work with. Students, residents, nurses, technicians, office staff, clinical staff, everyone. I'm so happy to work with you. Thank you.
Thank you, Dr. Laub, for all your work and for those wonderful words. I now have the privilege of asking Dr. Narotsky to come up one more time, along with Linda Leitner, to join me here as we present the medallions to the two of you. Want to stand right here, please? The script reads, Dr. Narotsky, Mrs. Leitner, Linda, the generosity that you and Dr. David Leitner provided to make this professorship possible will stand as an enduring legacy of your efforts to improve the lives of patients and their families throughout the region and beyond, in keeping with the missions of the University of Vermont and the Larner College of Medicine. Please accept this medallion, a replica of what we just provided to Dr. Laub, and let it serve as a tangible reminder of the generosity that you have provided, and more important than that, the impact on the college, those who hold this endowment in perpetuity, and for all the patients' lives that they might affect. Congratulations and thank you.
Thank you.
One picture.
Oh, okay.
Take that from you. Yeah, thank you. And please share some words with us.
Thank you, everyone. Just a few things about Dave. He was an ultimate planner. He knew he wanted to be a doctor in high school. Before retirement in 2015, David started looking into a way to continue his love of caring for patients and teaching residents at the medical school. After retirement by 2016, David acted on this commitment to match the initial investment given to the Department of Surgery. He initiated the funding to establish the full Professorship of Plastic Surgery. In 2024, this promise was realized and this milestone has been reached. Congratulations to Donald Laub for his contributions to the department. David and I are inspired to support the division through the endowment. Thank you.
Thank you so much, Linda. And I've got to say, having attended the memorial service and learning about your husband, his great, amazing achievements, and something to do with hats, that clearly brought joy and levity as he had his own distinguished style, all the while serving as a role model for as a physician and surgeon, and I feel confident he's looking down on this, and I know would be smiling. As we conclude our program today, we have one special event that remains, but I do want to once again thank the Department of Surgery and David and Linda Leitner for their generosity in endowing these positions that will outlive all of us. Your name, the Department of Surgery, have made it possible for, in perpetuity, surgeons here, the Larner College of Medicine, the University of Vermont, to, with pride, be invested in an endowed professorship, and that's really quite special. So thank you, the Department of Surgery and David and Linda Leitner. Thank you so much. I'm incredibly proud to be a part of this college and the Department of Medicine, don't hold it against me, and a member of the university. We can take such pride in this organization, in our college, in our faculty, our students, and our staff, who every day are working to the benefit of patients and their families. Our work would not be possible without the generosity of the donors we're acknowledging today, and the donors that are in this room and on live stream, and future donors to our college and university, whose impact is immeasurable. As I mentioned, for time going forward, the generosity that you've provided is going to have an effect on our faculty, students, staff, and most important, their patients. So I want to thank all of you for being here with us today and those who have joined us on live stream. I also want to acknowledge again Drs. Sowden and Laub. Congratulations on this great honor. But wait, there's more. I'd like to now ask Monica DeLisa, who I already introduced, to join me as we thank the Department of Surgery for completion of the visionary philanthropy and David and Linda Leitner for their generosity. Monica.
Thank you, Dean Page. And President Prelock, would you join us, please? And may I ask if there are any other green and gold professors, if our two newest green and gold professors will join me, please. And if there are any other green and gold professors in the room, we'd love to have you come up and join us. So one of the things we talk a lot about at the foundation is really building a culture of philanthropy. And what does that mean in the long run? A culture of philanthropy means that we're all in this together. We're all working to find a way to enhance and bring our work forward through use of philanthropy and of gifts. And there is no better way to recognize that than what you see here, and what the Department of Surgery and what our donors and what Linda has done to help support us. So at this time, and actually, can I grab one of those? A little hard to offer that one. So at this time, I want to give a toast to this great embodiment of a culture of philanthropy at the Larner College of Medicine. And thank you all for being part of this moment. On behalf of the UVM Foundation and the Larner College of Medicine, please raise your glass and toast to thank the Department of Surgery, Linda Leitner and her late husband David, for their extraordinary philanthropy and support of the outstanding faculty we are recognizing today. Cheers.
Very nice. We did mention, in case anybody's wondering, some people are going back to work. I promise this is zero alcohol. It's sparkling cider. It is delicious. And those who have scrubs on are going to do more work today. You're welcome to keep going and not be impaired. This concludes our formal event today. What a wonderful day. What an amazing way to honor Dr. and Mrs. Leitner, to honor our new inductees. We have food and drink that is going to be served right now. Thank you so much for joining us today. Everybody, please stay well and have a great afternoon. Thank you so much.